joined today by the Chief Health Officer, Dr. Kerry Chant, Deputy Secretary of New South Wales Health, Susan Pearce, and many nurses, graduate nurses and midwives who have started last month as part of our significant investment in New South Wales Health across our state. And Emma Purser-Hanson, is that right?
Yes, it is.
Emma Purser-Hanson will be speaking as well in terms of her experience and many of the nurses who will be starting at this most important time for our state. We're also joined by players for the All-Star game on Saturday evening, where we'll be announcing today a major booster campaign. We've already sold 25,000 tickets to the game on Saturday night, a very important game, which obviously Ben Franklin will speak to as well in our rugby league calendar, and the importance for our First Nations people here in our state and across our country. But today we're announcing and introducing some of our graduate nurses and midwives. We've invested, there'll be 2,800 starting. Around 1/3 of those will be located in regional and remote New South Wales, and that's incredibly important at this time as we move through. The state continues its substantial investment in healthcare across the state, and I want to thank our nurse and midwife graduates because they are starting at a very important time. They are the heroes on the front line throughout the last 2 years of this pandemic. There can be no more important job right now than our frontline health workers. So I want to thank our graduates, and I want to continue to thank our health workers, our nurses, our doctors, our allied health professionals right across the state, who for 2 years have worked day and night to keep our people safe, to give them love and care. As the Health Minister was just saying, when you go into a hospital, what do you always remember is the great care and love that is given to you by our nurses. And it's great to see today the enthusiasm, the excitement of our nurse graduates who have started last month in many hospitals, particularly across Western Sydney, which the Health Minister will speak to. In addition to that, I want to announce today that we've hit 50% of our booster shots for those who are eligible across our state. We want to continue to ask people to come forward and get boosted. We're announcing a campaign today that at this game here on Saturday night, between 4 and 8, we'll have a booster clinic set up for people to walk through. If you're eligible for a booster shot, if it's been 3 months since your second dose vaccination, or alternatively 4 to 6 weeks since you've had COVID, please come forward and get your booster shot. We'll also be providing over the next month, every weekend, walk-in appointments at any of our 40 centres. So I know that everybody has made a significant effort over the last 2 years. Significant efforts, major sacrifices, but that has all paid off. We're in a very strong position here in our state. We're seeing hospitalisations and ICUs fall. And that's because of the effort that every one of you has made in coming forward and getting vaccinated. And now we just need to ensure that that effort continues in respect of boosters. The evidence is clear, the facts are undisputed, and that is that boosters save lives. They reduce hospitalisations and ICU presentations. So we are providing substantial opportunities with our 40 clinics across New South Wales, provide that opportunity to come forward and receive a booster shot. And obviously as well, you can make those appointments to your GP and your pharmacist, but we have to keep this sustained effort going. I want to thank everybody for the efforts they've made, particularly over the last 2 years, but we've just got to keep going and move through over this next period of time. We know that boosters keep you, your friends and your family safe. The final point I'd make today is obviously a number of speakers. The final point is in relation to the changes that Minister Hazzard will speak to in respect to visitations for patients in our hospitals across the state. We know that there's been many heartbreaking stories. There's always a fine balance. We have to be cautious given the high risk setting of our hospitals, but ultimately as well we want to make sure that compassion is the major focus as we move through. And we want, in those circumstances where we have patients at the end of life, that their carers, their loved ones are there for those obviously very special moments. I want to thank the Health Minister, but particularly the health teams, because we know our health teams across our state have been under stress. Everyone has always wanted to do what is right. There's always a fine balance. We have to balance compassion with caution in what is a high-risk setting. We want to make sure that people are protected in our hospital system, but ultimately as well, we need to have the compassion for people right across our state. And I think learning from some of those heartbreaking stories and listening to those stories over the course of the last few days, I appreciate the change and the direction that and the new guidelines that are being issued by the Health Minister today, and I know that will make a real difference to provide support for those people who are coming to the end of life, ensuring that they have their friends, their carers and their family around them. I'm now going to pass to Minister Hazzard to speak in a bit more detail in relation to the booster shot campaign. Our wonderful nurses that are have just commenced working in our hospitals right across our state. Then Dr. Kerry Chant will give a public health update. Susan Pearce will provide an update in relation to the health system here in New South Wales. Then we'll hear from Minister Franklin in relation to the importance of this game and the importance of the booster shot campaign right across our state. And then Emma will speak as well in relation to the excitement that she has in commencing in our health system here in New South Wales. Thank you.
Good morning, everybody. It's a privilege to be here with all of the nurses who have come on to work just in the last few weeks here in New South Wales. There are 2,800 incredible new nurses and midwives who've just started work in our hospitals across the state, 130 hospitals. Of those 2,800, there is about 1,200. So between 33% to 40% of all of those staff are going to work in our regions. So every part of the state is going to have excited and well-trained new nurses to do what nurses do so well, and that is to care for us no matter where we are in the public health system across New South Wales. We're very lucky this morning to have a representative group of them, and these young people have all finished their training. They've all trained at universities including Notre Dame, Charles Sturt, Western Sydney University and Sydney University. And this group are going, they've just been talking to me, they're all heading off to local hospitals, so Mount Druitt, Blacktown, Westmead. And Emma Hansen, one of the nurses, will speak on behalf of the nurses at the end of this press conference, just to tell us a little bit about what they're going to do and what they're feeling today. It is a time, I think, to thank nurses across the state. We have obviously lived now through 2 years and 1 month of this COVID pandemic, and nurses have been at the front line. They've been looking after us. They've taken the stress and the pressure that has kept us all safe. So on behalf of the government and the broader community, I thank all nurses and all medical practitioners, all doctors, all allied health staff, the cleaners, everybody who's worked so hard to keep us safe during this last 2 years and 1 month. I also just want to acknowledge that the boosters are still the single biggest issue for us at the present time. If we have 95% of people basically close to double dosed, and we've got closing in on 50% of people who are boosted, it still leaves around about 45% of people who haven't or had their booster. So what we do know is that boosters reduce the likelihood of transmission to you or to others if you do happen to get it. They reduce the severity of the illness, and they reduce the likelihood that you'll end up in intensive care. And of course, sadly, some people have died and will continue to die from this terrible pandemic. So it reduces the chances of you actually dying. Please go and get your boosters. Minister Franklin will say a few words about Aboriginal residents in New South Wales. But I would like to just say thank you to so many of the Aboriginal community for going out and getting vaccinated. Overall, it's in the mid-80% now of people who've been vaccinated. But of course, we do have some pockets, some communities where social media is still putting people off, Aboriginal people and non-Aboriginal people, from having the boosters. Can I just tell you, ignore the social media. It is next to useless. Listen to the science. Go and get boosted. It will save your life and probably save family members' lives as well. Just do it. Get boosted. Hospital visitations. Obviously, during the course of this ever-changing pandemic, there have been ever-changing rules and guidance for visitors to hospitals, and it has been challenging. In many cases, I've dealt personally with with people who have had family members who are palliative or passing away, and it has been really quite horrible that there have had to be limitations on visitors into hospitals, because obviously the balancing act is trying to make sure that we do give access, but also to loved ones, but also make sure that the broader hospital patients are actually kept safe. As we moved into this stage though of Omicron, there has been a review going on now for the last 2 or 3 weeks. There have been some changes actually in the last 2 or 3 weeks already, but new guidance was completed yesterday by Health. They worked with a number of different groups, including representative patient groups and medical groups, to agree on a set of guidelines, and those guidelines are being distributed today to the entire health system. But I would say this, first and foremost, as I've stressed to the health system, and I'm sure the nurses and doctors and nurses know this, but sometimes it's a little difficult, care and compassion should always be the overriding guide. But of course that care and compassion, it has to extend to the immediate patient who a visitor wants to see, but also care and compassion to the broader hospital community to keep them safe. So there's a balancing act here, but I'm satisfied that the new guidelines being issued today to the 400 health facilities and 170,000 health staff across the state are as good as they can be for this moment. I'm not saying that there might not be further changes along the way, there might have to be. And I also emphasise that in particular areas there might be a higher rate of transmission of COVID, and in those areas hospital staff, the clinicians, the doctors and the nurses will have to apply their professional judgment to those particular issues. So it will vary in some occasions, in some areas. But overall, there's very clear guidelines now that, for example, if there's somebody who is sadly at the end of their life, or in palliative care, that everything should be done to try and ensure that those individuals do have their family members, their friends, able to see them. And of course, women giving birth, women going through that amazing process of new life will certainly be able to have their partners with them. But again, those are issues which each hospital will work through. The final comment I just want to make more broadly is that the health system is standing up again to this pandemic. It continues to hold fast in terms of making sure that our hospitals are there for patients and caring for patients. But I am absolutely delighted to be able to tell you that only a few weeks ago we had 6,300 staff furloughed. They were either having COVID, that is suffering from COVID, or they were close contacts. The latest advice I've had is that now those numbers have dropped to just over 2,000, about 2,200 as at today. So we certainly are seeing a little less pressure on our health system, and that's to be something to be very thankful for, and I am very thankful for it. At the end of the various presentations today, we'll hear from Emma Purser-Hansen, who is one of the new young nurses that is representative of the 2,800 nurses, and she just said to me there's a lot of excitement. I think the expression was hell yeah. She's very excited and they're all very excited, so hopefully she'll be able to give us a little insight into how they're all feeling as they've started their first few weeks on the job. Thank you.
Thank you. Thank you, Minister and Premier. It is actually pleasing to see the case numbers come down in our hospital system. We've got 1,795 people in hospital, including 121 people in ICU, of whom 55 are ventilated, and we're hoping to see those numbers come down further over coming days to weeks. In terms of our positive tests, we've had 10,130 positive tests returned, including 5,824 positive rapid antigen tests and 4,306 positive PCR tests. The PCR tests, the 4,306 positive PCR tests, were returned from 32,167 PCR tests. Can I thank the community for continuing to engage with both rapid antigen testing and also PCR testing. Getting tested if you've got symptoms or if you're a household contact is one of the key strategies in preventing onward transmission. So thank you, and we thank everyone who is adhering to that guidance about isolating in the household and also isolating if you're a case. Sadly, we've got reporting the death of 24 people with COVID-19, 15 men and 9 women. Of the 24 people who died, 1 person was in their 40s, 1 person was in their 60s, 5 people were in their 70s, 9 people were in their 80s, 7 people were in their 90s, and 1 person was aged over 100 years. 8 people had received 3 doses of COVID vaccine, 9 people had received 2 doses, and 7 people were not vaccinated. And as you're aware, we'll give the update tomorrow in relation to deaths overall and some sense of the underlying conditions that have contributed to those deaths, and also expand on the vaccination status, particularly for those younger deaths, so that we convey that to the community. But my key message is to echo everything the Premier and the Minister has said in relation to the importance of booster. So there is no doubt that the majority of people need 3 doses to be up to date with your vaccination, and some will actually be 4. So if you've got those underlying health conditions, transplant patients, you're on immunosuppressive drugs, check with your doctor about what schedule you should be on. So 3 doses are required for most, and 4 doses for some of those people that have got underlying health conditions. Thank you.
As Dr. Chan has said, it is really very pleasing to see those hospital and ICU numbers coming down, and we'll have some more to say about that tomorrow in terms of how that's tracking against our model. One thing is clear though, our health system continues to work very hard to deliver an outstanding result for the community of New South Wales, and we could not be more proud of the work that they have done. 31 years ago, I was one of those graduate registered nurses, so it's with great delight as a former Chief Nursing and Midwifery Officer in this state and still a registered nurse to welcome our new graduate nurses and midwives to New South Wales. It's a very exciting time for people as you start your work in health. Got that uniform on and off you go, but it's also very daunting and a little bit scary. So please be kind to our new nurses and midwives as they start these early years of their practice. And as I've said to them this morning, who knows, one day you could end up with a great job like mine. Nobody particularly responded in the affirmative to that offer, but you know, you never know. Look, one of the other things obviously today is the booster rollout, and the Premier and the Minister and Kerry have covered this already, so I won't belabour it. But one of the things that we do know about our community here in New South Wales through our various surveys is that there is still a very, very high intention for people to have that booster shot. 89% of respondents say that they will have the booster, so it's just a matter of timing. If you're delaying, or if you're thinking about, oh, I'll get it in a couple of weeks, don't delay. Please come forward and get it. Dr. Chan has previously given guidance if you've had COVID, within 4 to 6 weeks after having had COVID, you should be okay for your booster so long as you're feeling okay. And this weekend and for the next 3 weekends after that, walk-in clinics right across New South Wales, as well as pop-up clinics. We're focusing very heavily on our Aboriginal population, which Minister Franklin will speak to, with pop-up clinics right across the state. And we're currently in the throes of finalising plans around with our cold community, with Multicultural New South Wales, about how we assist those communities to get boosted. So you do not need an appointment. We encourage families, so if your kids haven't been vaccinated yet, mum and dad might need a second dose or their booster, everybody can come, no appointments needed, come in and get a booster shot or your first and second dose this weekend. All you need to do is walk in.
Thanks very much. Can I start by acknowledging the traditional owners of the land and pay my respect to elders past, present and emerging. Can I also acknowledge 4 extraordinary Indigenous All-Stars who are standing behind me. Ryan, Tyrell, Tallulah and Caitlin are amazing players, but more than that, incredible ambassadors for their culture, for their sport and for their communities. I had the privilege of meeting a number of them at the wonderful welcome event that we had for the All-Stars game this Saturday, which was held on Tuesday, including a smoking ceremony, a corroboree. It was incredibly powerful and incredibly meaningful. And I just wanted to say thank you and congratulations to Andrew Abdo, the CEO of NRL, for the work that he's done in this space in recognising community and recognising the need for reconciliation. It's been a week for the NRL and for the Indigenous All-Stars to focus on culture and to celebrate culture. And that, of course, will culminate in Saturday's magnificent event right here. We're so thrilled it's going to be here. It's the first time it's been in Sydney, but more importantly, it's the first time the All-Stars Clash has been in Western Sydney. And that's important because Western Sydney is the home to more Aboriginal people than anywhere else in Australia. And of course, because of that, a lot of Aboriginal people will be attending the game on Saturday night. And that's one of the reasons why we're here today. We know two things. We know that vaccines work, that boosters work, and we also know that, as the Minister said, even though the Aboriginal take-up of vaccines has been very high and good, it is still lower than non-Aboriginal people. And so we're keen for as many Aboriginal people to take advantage of the boosters as they possibly can. That's why we're so excited that there's a booster hub, a pop-up hub, here from 4 till 8 on Saturday afternoon. It's free, it's walk-in. As Susan and Kerry have said, there is nothing more important than protecting yourself, your loved ones, your families and your community, which we know is all important. So please come along on Saturday night. There's already 25,000 tickets that have been sold. And if you do come along, you haven't had your booster, grab your booster, because there's nothing more important than keeping your clan protected. Thank you.
Hello, my name is Emma. I'm here representing Western Sydney Local Health District. So I have just been working in emergency at Westmead Public Hospital. And I just wanted to say that I'm so proud of everybody for standing up and stepping forward to start our new graduate program early, to support our local community and also to support all of our colleagues, all the doctors, the nurses and all of the medical professionals. I'm very excited to be starting my new graduate program, and yes, I'm very excited. I just wanted to say, please go and get your booster shot. It's not only going to protect me, it's going to protect all of the nurses, it's going to protect all of the healthcare professionals, and it will also protect all of the community as well and everyone around you. So, yeah, please get vaccinated.
Premier, can we clarify with you if the target changes its advice to say that you need 3 shots to be fully vaccinated, will you force international tourists who've only had 2 shots into isolation?
Well, the first things first. I'll wait for the ATAGI advice, and that's coming to National Cabinet. We'll consider that, and then the New South Wales government will obviously consider that advice and make determinations off the back of it. Now, ultimately, I saw the Prime Minister say yesterday that from the international borders perspective, that you need at least 2 doses to come in, and we'll work with the federal government in relation to it. But I don't want to get into a hypothetical discussion. I want to focus on the advice that we received today. I will consider that advice, and then our government will meet to make a determination in relation to how that advice would be rolled out in a range of settings that we currently have in place. Now, there are different settings in different states where that ATAGI advice might make certain changes, but I haven't seen the advice, and until I do, it would be inappropriate for me to preempt what our government's decision would be.
But you often talk about the need to get ahead of things. So presumably, you as a government had this discussion, and you would be preempting that decision to work out what you will do in case.
Well, it's a complicated area in circumstances where different countries have different rules and procedures in place in relation to their vaccination program. Now, what we have said is that we've ensured that those people coming into our country during the pandemic have 2 doses of the vaccination, and if people are unvaccinated, they need to go through a hotel quarantine system. In that period of time, we've had a high vaccination rate of 95%, and we're running an incredibly strong booster shot campaign at the moment. That's why we're here again today, and it's very pleasing that's at 50%. So we'll work with the Commonwealth Government. We'll see. I've always believed it's in the best interest of the country if we can find unity in relation to some of these positions, but I'll consider that advice today. I'll seek the advice of our Health Minister and our health teams, and then we'll make a call in relation to how we'll apply that advice across the state. But the spirit and the intent of the decisions that we'll make will be in line with the ATAGI advice.
With the Premier, the border open in 11 days,
Yeah.
could you have a situation, or are you worried about a situation, where you might have people who have had 2 shots, they think they're fully vaccinated, ATAGI moves the goalposts, and you then have to force those people upon arrival at Sydney Airport?
Well, we won't be doing that. I mean, this is a common sense approach. We are completely in favour, as we have been in our state for many, many months. In fact, through the entire pandemic, of opening up international borders. We cannot live here in a hermit kingdom on the other side of the world. We need to rejoin every other country globally and do that in a sensible and measured way. Now, the federal government has recently announced that international borders will open on the 21st of February. We wholeheartedly welcome that announcement. We, as a state, dispensed with hotel quarantine for those who had received 2 doses of the vaccination. That was the right approach. Other states followed. Now, as we move through, and obviously it's slightly complicated by the ATAGI advice, but we'll consider it. And ultimately what we continue to do in our state for our people, so we have not mandated booster shots. What we have said is we've strongly encouraged people to go out and get that booster shot. And we continue to do that day in, day out, because we know it saves lives. As the Health Minister, Dr. Chant and Susan Pearce has said, and Emma has said, that we know that boosters reduce the symptoms, reduce the severity of the disease. We will continue to push that. We'll get the advice if it comes to National Candidate Day from ATAGI. We'll consider that advice and then we'll make a decision.
Premier, you've got a number of grad nurses coming on the announcement, but also on Tuesday there's still a massive walkout of nurses union. What are you doing to stop that walkout?
The Health Minister might make some further comments in relation to that, but we're always, whether it's our nurses, our doctors, our police officers, all public servants, there are always going to be challenges from time to time, particularly with our frontline health workers, our nurses. We understand that it's been a very difficult 2 years. The health system's been under pressure here, around the country, around the world. Our nurses are our heroes on the front line. And whenever we work through those wages issues, we sit down at the table. I've done that in my former role as Treasurer over the last 2 years. I was out with the Transport Minister yesterday. There's been issues in that space. We're always willing to sit down, work through those issues. Where we can find resolution, we will. We want to make sure that all our frontline workers, the wonderful graduates that are starting today.
So are you trying to find a resolution before Tuesday though, to stop it from happening?
I am completely in favour of the right and support the right of people to protest and air their views. That's an important part of our democracy. I actually embrace that. I think it's a really good and positive thing. What's important from a government's perspective is we listen to those concerns and understand them. And where we can make changes, we will. Now, I know that the Health Minister has had numerous discussions in relation to the unions. And since becoming Premier, I've also sat down with the Health Minister and the unions in relation to some of their issues. Now, we're never going to be able to resolve all issues. We accept that. But where we can find common ground and we can achieve outcomes together, we will do that. And that's my commitment as Premier.
Premier, by-elections coming up on Saturday. Are you concerned they'll be swinging at the
By-elections are notoriously challenging for any government. By-elections will be by-elections. We're focused on getting on with the job and the issues that matter to people across our state. And I know that mums and dads around New South Wales are focused on the cost of living, household budgets, being in work, their healthcare. That's exactly what this government is focused on day in, day out, and will continue to do so through the by-elections. We've got some very good candidates replacing some very long time serving members, with former Premier Gladys Berejiklian, former Deputy Premier John Barilaro, and the former Transport Minister Andrew Constance. They've served their communities incredibly well for a long time, and I know that those candidates who are putting their hands up for the Liberals and Nationals will serve their communities well if they're elected on Saturday.
Premier, this week we haven't seen you dedicate much time to campaigning alongside those candidates. Are you taking voters for granted in those three?
My job is to represent everybody across New South Wales and work hard in the middle of a pandemic to get our state through. It would be completely inappropriate for me to be focusing too much of my time campaigning and not enough time governing for the people of our state. That's what I'm focused on. I was able to visit Bega, had the time to visit Bega last week and to visit Cooma in Monero and meet with a candidate and meet with local business owners. I've been out to Strathfield, been out to Willoughby. I'll drop into Willoughby today. But ultimately, as Premier of the state, my job every day is to focus on getting our people through this pandemic, ensuring that when we get to the 27th of February, we continue to lift restrictions and move through. That's my focus, and that's what I should be doing as Premier of New South Wales.
You run the risk of being plunged. You run the risk of being plunged further into minority this weekend, though. At the last election, Gladys Berejiklian said she would not work with the shooters and rely on their vote. Will you rely on the vote of the shooters party?
We've been a minority government for the entire term, and we've navigated legislation through the Parliament in the best interest of the people of our state. Since becoming Premier, I've always had an open door to members from whatever political persuasion they come from. And I've met with many. I've met with members...
At the last election, you likened the shooters to the National Rifle Association. Do you still hold those views?
Look, I've had concerns with the shooters in the past, but ultimately, if the shooters or the Labor Party or the Greens or any crossbench party has genuine concerns that can be resolved, I will work with them. I've said that from the outset of my premiership. I made that very clear to all members of the crossbench in mid to late last year. And I've met with numerous members, whether that's independence in relation to water issues, whether that's local members right across the state in respect of their concerns.
So my job, ban on the shooters is out the door under your government.
Well, I think you're conflating two issues. What I'm focused on is that there are legitimate concerns from local members and from members in the upper house in relation to matters that they would like to raise. I will meet with them. I've said that from the outset of my premiership, and I will continue to do that. And whether that's independent members in the lower house, whether that's... I was out in Coonamble with Minister Franklin last week, working through a whole range of issues. And the local member there is not a member of the Liberals and Nationals, but I met with him and he raised issues that were of a concern to his electorate. It would only be appropriate for me as Premier of the state to meet with local members, as I've always said from the outset.
Sorry, Premier, that wasn't the question though. The question was about relying on their votes in the House.
But we haven't... I can't see a reason why we would. That's a separate issue. I'm saying that you're conflating two issues.
No, the questions were about relying on the votes of the shooters in the House.
No. We've got a very good relationship with independents on the crossbench. We've worked throughout this entire term of government with those members in the lower house to navigate legislation in the best interest of the people of New South Wales. We won't always agree on legislation. I accept that, but ultimately working together will get more done. But no, it's not about relying on those members for votes. We've had a constructive relationship with the crossbench in the lower house through the entire term in government, and as my time as Premier, I've continued that relationship and will do so going forward. And what I will say about those members is that they have been incredibly constructive too, because they know the importance of stable government, particularly when a government is in a minority situation, that you have a stable parliament. Stable parliament leads to stable policy decisions, which leads to better outcomes for the people of our state. But I'll work with... My door is always open. I've said that from the outset. And there are a number of issues across the board that independent members have raised. Members of One Nation have raised with me last year on a whole range of policies that I'll consider, and if there is merit, we will deliver. What we shouldn't have is just an outright rejection of people's ideas, members of Parliament's ideas, simply because they come from a certain political persuasion.
Premier, the Auditor General, another statement report calling out Treasury's attempts to hinder her investigation into starting. You were the Treasurer at the time. What responsibility do you take for Treasury's attempts to stymie her investigation?
Well, look, I haven't read the report.
You haven't read the report?
No, it came out yesterday. I haven't had the opportunity to read the report yet. Time is limited. I will read the report. And the reality is, if there are areas, the Auditor General plays an important role in providing insights to governments in relation to decision making and approaches, and where systems can be improved. If Treasury can improve their processes in relation to the provision of information to the Auditor General, then of course we take that on board, and it should be improved. And I would expect that to occur. Just like when every Auditor General report comes out, and they're generally scathing on government. That's just the nature of the reporting. What's important is that the government considers it, the relevant minister focuses on it, and ensures that within the public service, changes that need to be made in relation to a whole range of areas are taken on board and adopted. And that's what my expectation would be.
Premier, if you describe it as late, unsophisticated, inaccurate forecasting treasury, this is all while you were the treasurer. I mean, this is pretty serious stuff here, and you've had to inject $5 billion into this to get her to sign off on it. How can you guarantee that that money's not going to flow down?
Oh, well, it won't. It won't. That's just another scare campaign from the Labor Party. Let's take this back a step. The Transport Asset Holding Entity and the movement since 2015 to go down that path was exactly in line, well, not exactly in line, but generally in line with the approaches that have been taken by the Labor state in Queensland and the Labor state of Victoria.
Sorry, Premier, the Auditor General says that you can't compare it to what went on in Victoria.
Well, she may have views in relation to the concerns she has in respect of the provision of information, but yes, you can, because the structures in the main between the management of transport assets in Queensland and Victoria are very similar to the approach that we have taken in New South Wales, except the concern in relation to forecasting, in relation to how much funding needs to be required. That adjustment was made. Taking a step back, the facts are very clear, and that is that the Auditor General provided an unqualified account in relation to Treasury's position on the Transport Asset Holding Entity. They are facts. If there are issues in relation to the engagement with New South Wales Treasury during that process, where we all know that there were concerns and difference of opinions between Transport for New South Wales and Treasury in reaching that final determination that then led to engagement with the Auditor General, then we will take that on board and improve those processes. I want to make sure that all areas of the New South Wales Government, in their dealings with the Auditor General, provide advice in an accurate and in a timely manner. We're not always going to agree, but ultimately we need to be in a situation where our public service here in our state has a strong relationship with the Auditor General. When information is due to be required, it should be required, and if Treasury needs, and I'll probably leave this to the Treasurer, but if Treasury needs to review its processes in relation to its engagement, whether the Auditor General or any of the other integrity agencies, they should take that on board and adopt their processes appropriately.
So you stand by Carney and you don't believe it should be done well?
Absolutely stand by it. It is the right approach in terms of the management of state transport assets. It's not something that the New South Wales Treasury dreamed up. It's something that has been followed or led in other jurisdictions. It is something that has been worked through by the New South Wales government since 2014, 2015. It goes back a long time. It's a complex area in the transformation that has occurred into the establishment of state-owned corporation. But ultimately, it's the right approach. But if there are issues along the way, they need to be ironed out. And my expectation is the major concerns that come through the Auditor General's report, which I'll read, but in terms of the advice that I've received to date, is in line with the approach and the engagement between New South Wales Treasury and the Audit Office. Now, if that needs to be improved, it will.
Regarding the hospital industry,
yeah,
what's actually changed? Because wasn't there a level of flexibility previously, and doctors and hospital administrators could use their professional judgment?
Yeah, Brad will provide.
Sorry, Clinton, could you ask the
What
question?
actually changes to these guidelines? Because previously we were told there was flexibility, and when you mentioned that doctors can still show their professional judgment and effectively, I guess, stop with it.
In the past, I think you'd understand that clinicians and nurses and the broader health staff in every situation are making professional judgments, but the overriding guidance is now to look at care and compassion, which they do generally anyway, but it just puts it at the centre of the guidelines for them and helps them to be able to make professional decisions in weighing up the risk balance, which of course there is, and that's what they do in normal circumstances anyway in terms of treatment. This is the broader treatment of the patient in the sense of allowing visitors in. I think it makes good sense. It was also the examples that, I mean, I've worked in many cases over the last 2 years and had to grant exemptions in the most difficult of circumstances, and I can tell you from personal experience as the Minister that to try and weigh up all of the balanced risks is really hard. And you know when you make a decision that if you allow somebody in who may not normally fit the criteria, that you're taking a chance. But sometimes you do that because that's the humanity that drives it. I, as Minister, have worn that many times in the last 2 years, and many clinicians have worn it. This just helps those clinicians. I mean, I don't have a guidebook. There's no guidebook for me, but for the clinicians, at least we can give some guidance and some help. The other aspect is talking to a number of the people. The exemption process has proved really difficult. There was a case mentioned only this week, a lady who passed away. Her daughter was unable to be with her. Gail was unable to be with Shirley, and she sat outside the particular hospital for nearly 5.5 hours waiting for an exemption document to be prepared. Well, these young people behind me, you know, world's best trained nurses, they're there to look after patients, but sometimes to get sidetracked off and to start filling out the paperwork for an exemption has proved a little challenging, as you'd expect when we had up to 6,200 staff furloughed. So this reverses it. It gives you a presumption that you can go in and visit your relatives based on that care and compassion. And look, if it needs some more work, we'll do it as we go, because we're in a pandemic and that's what happens. Sorry. Daniel, if you've got another question.
On this exact topic, who previously would have been left out who's now allowed in? Can you give us an example?
Look, I think there's been many cases where someone who was passing away in a palliative care end of life has found the family, there have been many cases where the family or friends of somebody who was passing away and COVID was a major issue, that the family were denied the capacity to go to be with that loved one. So I know on many occasions I've asked doctors or nurses where they've insisted that is the safest course during various parts of the pandemic, to at least set up some structure. Holding up a social media, a phone or something so people can at least be with their loved ones. It's a horrible situation, and it's been necessary at various stages. But this now gives it the very clear presumption that if someone's passing away, if someone's at end of life, and sometimes that's even difficult to know, there might be a view that this person will pass away, but when, there will be a presumption that the family members can come in. And in individual hospitals, I'll still need to limit the numbers, because one of the things about this is that generally it requires a nurse, a clinician, to actually escort a person coming in. It'll also be difficult, for example, it'll remain difficult for people who haven't been vaccinated. If they are not vaccinated, there is capacity under these guidelines for there to be arrangements in place, but such a person would probably have to come in wearing full PPE, be escorted and masked. Such a person in that situation would have to wear full personal protective equipment, so a gown, a mask, and they would have to be given a guide of a nurse. So a nurse would have to take time off looking after a frontline patient to actually escort the person into the room where the person is passing away and will pass away either an hour, and a day or 2 or 3. So it takes staff time as well. It's a complex and difficult and challenging situation, but I remind everybody, and I think you guys all know this, and the public certainly know it, it's a 1 in 100 year pandemic. Life's difficult, but care and compassion is the rules that we're making sure are central to this. Can I just say, Andrew Abdo and the amazing Indigenous All-Stars, I'm just blown away by the game that's going to happen here very soon. And Andrew Abdo, as the head of the NRL, hasn't had a chance to say anything, so I'm just going to ask him whether he'd like to say a few words on behalf of this amazing event. And can I say, as on the medical side, don't forget when you get out here, there's going to be boosters available. So you get to see the Indigenous All-Stars, fantastic people, but you also get to get a booster. Come out and see the game. Andrew.
Good morning. It's a beautiful morning. Sport brings us together. We're very excited for Saturday. It's the start of our rugby league season in 2022. There's a lot to look forward to. I know the players are extremely excited and they're ready for the game. And I know our fans are as well. As was mentioned earlier, we're expecting 25,000 people. It's a long time since we've had live footy in Sydney, in New South Wales, in this stadium. There's a lot to look forward to. It's not just about Saturday though, it's about the whole week. And the Indigenous All-Stars Week is extremely important and special to us. It's about community and it's about culture. It's an opportunity for our players, our fans, everyone to celebrate the wonderful multicultures of Australia, but importantly, it allows our players to re-establish a connection to their roots. It allows us to learn about cultures and learn about that sometimes our differences actually make us stronger together. So there's a lot to look forward to. We have our Women's Premiership kicking off at the end of the month on February 27th, and we're all excited, as we know our fans are, to see live football again.
Just in terms of COVID protocols, are you expecting many games to be missed during the season because of, I guess, players contracting it or being isolated? And what are the latest protocols for the clubs?
Well, everyone has done a terrific job in navigating this panic for a long period of time now. I know we all have a lot of fatigue in talking about this. Our focus this season is on season continuity. The environment is different, and so we're gearing our protocols in a slightly different way. We certainly don't want the players living in bubbles any longer, just like the community. So we have to think about continuity differently. The rapid antigen testing is critical, and that's happening every day. We're asking the players to take reasonable measures to stay safe, but ultimately we don't want to miss any games, and we're not planning for the suspension or the postponement of any games. So we've had to think out of the box, and we've had to think about squad depth, the amount of players and teams that travel, and how we adjust our protocols to ensure that we play all games as planned. It's a busy year. We've got 2 NRLW premierships, we've got the Telstra Premiership as well, and then we've got a World Cup at the end of the year to look forward to as well.
And how does it work for fans then coming to games Saturday night or already the games throughout the season? Vaccination status and check-ins and so forth?
Yeah, that's up to the public health orders in each and every state. So on Saturday in New South Wales, it's terrific. The players have shown a lot of leadership in promoting vaccination and boosters. We're going to have a pop-up clinic here in the stadium, and the public health orders are in play. This is an open-air stadium. The majority of New South Wales is vaccinated. There's strong encouragement from all of us to get boosted because we know it's safe. This will be a COVID-safe environment.
Thanks, everyone.
Thank you, everybody.